Hi, my name is Nikhil Patel. I'm a junior at the University of Kentucky, and I'm a human health science major. My topic of research is medical marijuana, hence the title is Medical Marijuana Worth It? So medical marijuana is something that has been on my mind for a while now. This is because in some states it's legal, and in some states it's illegal. In some states and in some parts of the world, it's seen as a positive, miracle drug or even miracle medicine. And in other states and other parts of the world, it's seen as something negative. It's seen as solely a drug just to get you high and intoxicate you with basically no positive effects. So that discrepancy has always been on my mind. In medical marijuana, so to speak, is it's medical marijuana. It's prescribed as a medicine, can be prescribed as medicine. Some doctors recommend it, some don't. Some people recommend it, and some don't. So, which leads me to my introduction. So basically, marijuana itself is seen as a Schedule One drug, or is a Schedule One drug, meaning that it's illegal. Even in some states it may be legal, but federally it's illegal. Um, Physicians and people just like you and I have pushed for marijuana to be a Schedule Two drug, making it decriminalized. Allowing physicians to prescribe this. Unfortunately, the FDA has said no to that because of the negative effects, such as lung damage, anxiety, psychosis, stuff like that. But the problem with that is marijuana has been seen to have positive effects as well. So the clinical problem here is people don't understand or know yet if prescribing medical marijuana is going to be effective, with someone's course of treatment. Um, According to Marijuana and Lung Health, precisely, smoke via marijuana combustion contains similar toxins, irritants, and carcinogens like tobacco smoke. Because marijuana smokers inhale more deeply, they are more exposed per breath to tar. Furthermore, marijuana smoke enters the cell linings of large airways in the lung. So those are the negatives associated with marijuana physically, per se, because there are mental problems such as, it can increase anxiety, psychosis. Um, it can also slow your short-term memory. And those are the positives. But with positives, there's negatives, which is why medical marijuana is so controversial because, yes, it can be good. So, according to is marijuana safe and effective medicine? Yet, marijuana has shown many positive outcomes as well. In fact, the FDA has approved THC medications such as dronabinol and nabilon for patients with cancer, chemotherapy, and appetite stimulation in individuals with AIDS. Problem with this is, you know, AIDS and cancer are very serious diseases. But anxiety is also very serious. One's physical, or both of those are physical, versus one that's mental. You can't really decipher, which one's worse than the other because, this person with cancer and the person with bad anxiety, they'll both tell you that they both are horrible. So why does, the person with cancer, the person with AIDS, why are they allowed to receive medical marijuana, but the person with anxiety, you know, can't? Even though medical marijuana per se may or may not, decrease their anxiety. So medical marijuana, based on the studies and the literature I've reviewed, it's seen that it's safer, when it's derived, its pure chemicals are derived from it. So it's seen in is marijuana safe and effective as medicine. Most FDA approved marijuana based medications that derive from purified chemicals are considered to be safer versus the entire marijuana plant and crude extracts. And an example of that medicine is Epidiolex. So in this medicine, they take marijuana, medical marijuana, and they derive the CBD from it because seeing that CBD is actually the beneficial part, or where THC is the per se negative part, which is the mind altering part, that has psychoactive effects. So many studies have been conducted which show the positive effects in patients who do not respond to other treatments. So in a PubMed study, it showed positive outcomes for cannabinoid treatment for chronic non-cancer pain, which brings me back to the clinical problem, which related it to cancer and AIDS, because this person doesn't have cancer, yet it was helping treat their pain. But in this problem, the person with cancer was allowed to have medical marijuana, just them and the person with AIDS. But in other aspects, it's an anxiety, or maybe you broke your leg, you're not allowed to have it. Yet it's still going to be beneficial for the person who doesn't have cancer, but yet is suffering from pain. So based on these literature reviews, there are a lot of, positives, negatives, a lot of things trying to develop a correlation between medical marijuana and health. So a big one of these studies, which was very controversial, was the NITA study. So the NITA study found the opposite trend. States allowing cannabis showed a 22.7 higher overdose death rate in relation to opioids. So these states that had legalized cannabis showed actually a higher death rate from opioids. But it's crazy because in 2014, NITA also had a study that with states allowing medical cannabis, they possessed 21% lower opioid overdose deaths. So within a few years, the trend totally changed. Medical marijuana is legal, overdose deaths decrease, which is good. But years later, medical marijuana is legal, overdose deaths increased. Um, which, that's a great study, but there's a lot of bias in those things. As time passes by, maybe opioids became more available or they became more popular. There's a lot of things that come into play here, and you can't just pin it on medical marijuana. So that's why it's so hard, and so much more research has to be done, because it's so hard to find a correlation between medical marijuana really being worth it. Title of my research, because there's so many different articles and so many different research topics that have shown two different mindsets, and it shows correlation between the two different ways of thinking, as it's not worth it or it is worth it. But if one were to use medical marijuana or be prescribed it, there are best ways to use this. The first would be best practice, the legalization of marijuana. And there are two reasons for this, and two reasons I say this. So according to Peter Clark, or Medical Marijuana, Medical Necessity versus Political Agenda, it is best practice to obtain medical marijuana or marijuana-based medications legally, which will remove any adverse effects. So legally, this is because this is federally, looked at, federally approved. This has gone through lab testing. If a person wants to, obtain marijuana or obtain any drug that's illegal in general, they're going to do it because there are ways to obtain things that are not legal. That's just the world that we live in. So it is better to have, decriminalization of it, because when something is legal, it has to go through rigorous testing to make sure it's safe. If it's not safe, someone may think, oh, I want this marijuana to, relieve my anxiety, relieve my pain, and find out it's laced with something or just not marijuana at all, which leaves them worse off than they started. Second thing I think is harm reduction is a good way for the legalization. It's been studied and shown that, harm reduction is better than making something illegal. Like stated before, when something's illegal, people will find a way to obtain it. They're just going to obtain it illegally, meaning there's no safety precautions, there's no regulation. They could be obtaining anything, and they don't know what they're using. Harm reduction, definition, a simple way to put it is, let's say somebody is a heroin addict or a drug addict. Instead of sending them to jail, you give them clean needles to use. Instead of, arresting them, making them pay a fine, you give them a safe place to use the drug, because regardless, they're going to use the drug, whether it's legal or illegal. You're just giving them a better way and a safer way to do it, because drug addiction is a disease. And I solely believe that, it's in the mind, it's just like anxiety or, any mental disorder. It's a disease. So another best way is, instead of smoking marijuana, because that's the biggest issue, is lung damage. So smoking marijuana is bad. So basically, obtain marijuana and use marijuana through oils, edibles, stuff that will not affect your lungs. Eating marijuana, such as with, like I said, edibles, or rubbing oil on you, will still give you the same effects, still give you the same pain relief, anxiety relief as smoking would. It's just not going to be detrimental to your lungs. And finally, was stated from Medical Marijuana, Medical Necessity versus Political Agenda, it is stated it would be in the best interest of the government to progressively lower marijuana regulation, thus reducing illegal buyers. Additionally, the FDA should currently strive to regulate marijuana production and the varying THC concentration levels. Furthermore, more funding for medical marijuana research would be beneficial currently. So yes, it doesn't just have to be, regular marijuana that you find off the farm. or stuff like that, it should be regulated. There are many ways for marijuana to be obtained illegally, and if it's legal, that puts those black market people who put additives and stuff and sell marijuana that's not really marijuana. It doesn't give them a market because it's legal. Um, and that way, someone like a cancer patient or somebody who has anxiety or back pain, even that wants marijuana, needs marijuana, doesn't have to obtain it through a black market, can get it prescribed to them from a doctor, when they know it's safe. Which brings me to research still needed on this topic, which this is a big one because there is a lot more research in here on this topic. Medical marijuana. I mean, marijuana has been used for decades. That's not the problem here. The problem is that not enough is known about it. Not enough is known about long-term effects. Someone who smokes weed or consumes marijuana every single day. Not enough is known about that, and not enough is known as the effects. So, according to Is Marijuana Safe and Effective as Medicine? Concerning medical marijuana, very little is known on the long-term effects for the individuals of old age with impairments including cancer, AIDS, cardiovascular disease, multiple sclerosis, and more neurodegenerative diseases. So this is because marijuana is a very personal drug. It depends on who you are, depends on your brain chemistry, your physical makeup. Marijuana is definitely not going to work the same for everybody. One person with anxiety may experience the relief of anxiety, while another person with anxiety may experience way more anxiety from the marijuana. So, according to Marijuana and Lung Health, further research is needed on the effects of medical marijuana on lung health, according to the American Lung Association. So this relates back to the clinical problem in general and even the literature review, because lung problem is the one that everybody's worried about. There's not much said about in depth with the mental stability of marijuana, even though it's a little bit of research to tell me more anxiety, psychosis. But the most thing most people think of is smoking marijuana, and that's why lung health is the big thing that a lot of FDA officials, government officials, they're worried about. Prescribing this is just going to ruin their lungs. It might help with eating anxiety, but it's still going to ruin their lungs. So more research is needed on alternative new options to smoke marijuana as described in the current best practices. There's not really, besides maybe oils and edibles, which smoking it states that it works faster. It helps relieve the symptoms faster than an oil on your skin or even an edible. But there definitely needs to be alternative options. Since it's agreeable and it is shown that marijuana does cause lung problems, there needs to be more research done to show alternatives to people that need medical marijuana and need to be prescribed it, for different ways that they can use it. And that's all for my presentation. Thank you guys so much.